Hello, Victoria. Thank you for attending this lecture. And I would like to give like a summary on how technology has changed with physician contracts and nursing contracts. So let's just dive in. Technology platforms have changed the healthcare industry in recent years, especially when it comes to contract physicians and nursing service. In the past, and even with COVID, many healthcare facilities relied on paper-based systems to schedule and manage their staffing needs, and this often led to errors, miscommunication, and so many, errors, and it was bad. But you know what? However, with um, technology platforms, the this process has become much smoother and more efficient. So let's look at. Let me share my screen. Give me 1 second. No, it won't share. Okay. Okay. It won't share. I don't know what's going on. But one of the most significant benefits of technology platforms is that they allow healthcare facilities to streamline their staffing processes. So, for like example, by using a platform, they can quickly and easily search for available physicians and nurses based on their qualifications and experience and their availability. And I see this all the time, in the healthcare field. And so what it does, it really saves time and it reduces the chances of miscommunication and things like that. And there's another advantage of technology platforms, um, is that they make it easier for healthcare facilities to manage their contracts with their physicians and nursing services. Um, for example, facilities can use the platforms to track, their contract terms, monitor also compliance, and to ensure that all necessary documentation is in place because you have to keep documentation that is so important. And so this, with keeping, documentations in place, this helped reduce the risk of legal actions and ensures that everyone is on the same page. And overall, technology platforms has transferred the way healthcare facilities manage their contract with physicians and nursing services. Also, I have seen in the past, and they have made this process more efficient, less errors, more transparent. And as the technology continues to advance, we can expect to see even more uh, innovative solutions in this area, and that will help healthcare facilities deliver better healthcare to their patients. And so, you have any questions, Victoria, from the
No,
case study? Okay.
it's just actually, so I did the case study twice already, just review. And
Yes.
it's actually really interesting how it's the vendor management system
Yes.
um, plays a huge role in like contracting work. Like I never, like, I work for the government, so I know that there are contractors out there,
Uh-huh.
but they are for different specialties. I just didn't know that they were contracting like providers
Yeah. Yeah.
and
Yeah.
stuff like
Yeah.
that. So that's interesting to know. And then of course, like listening to it because I like listening to stuff. So
Yes.
just listening to what they were saying about the data pool, like you can pull the data and
Mm-hmm.
like the agency can pull it all and get a
Yeah.
better idea of that particular organization's need or how much they're making or how many contractors they have. I thought that was pretty interesting.
Yes. And also, it allows, the healthcare providers to provide better care for patients. Yes.
So yeah, the provider. So I guess that's what I was interesting. What I found interesting is that I thought like you had to be a provider for that organization and not like a contracting provider. Like I've heard of like nurses that go from different locations.
Yes.
I can't remember what they're called, but they hop from different
Agency nurses.
there you go, hopping from different organizations and doing that. But I didn't know providers can do that as well. So it, I mean, I guess I'm more interested in wanting to know like how that works. Like how do the providers and contractors all work together? And like, are you only for that agency for a particular or organization for that particular time, or if you're contracting, or you just fulfill the need and then you're done? Like, are you ever able to like sign on as a full-time like employee versus being a contractor?
It's
I,
possible. It's possible. I have seen it. You can, you start off like a staffing with an agency, and hey, if they really like your work and there is a need, of course, I mean, they will hire you full time. Yeah,
that's pretty cool. That's really
yeah,
interesting to know.
yeah.
Yeah, like I said, I had a friend who did nursing that kind of went all over the place. So, but I just didn't know about provider wise.
Right. Okay. Well, do you have it? I'm going to stop because let's see, stop share, stop recording.